Let me ask you something. What if there were a disease quietly destroying one of the most vital organs in your body right now, today, and you had absolutely no idea? No sharp pain, no dramatic warning, no flashing alarm going off in your chest, just silence. That is exactly what chronic kidney disease does to millions of people every single year. In fact, right now, an estimated 37 million Americans are living with kidney disease, and a staggering 90% of them, 9 out of 10, have no idea it is happening. They go about their days, drink their morning coffee, sit with their grandchildren, walk through the park, and all the while their kidneys are failing, slowly, quietly, without a single obvious scream. But here is the truth that I want you to hold on to from the very first word of this video. Your body does not stay silent forever. It will eventually begin to whisper, and then, if you don't listen, it will start to shout. Those whispers, those early, easy-to-dismiss signals, that is what we are going to talk about today. 9 of them. 9 visible signs that your kidneys may be in serious trouble. Signs that show up on your skin, your face, your nails, and even in your breath. Signs that most people chalk up to aging, fatigue, or dry weather. Signs that, if you catch them early enough, can genuinely save your life. Now, before we get into the list, I want you to understand something important about why kidney disease is so deceptive and why it causes so many problems that seem totally unrelated to your kidneys. Think about a row of dominoes. When the first one falls, it knocks into the second, which knocks into the third, and before long, you've got a chain reaction that spreads far from where it started. Your kidneys are that first domino, but they are also one of the most powerful ones in the entire row. Your kidneys are not just organs that make urine, not by a long shot. They regulate your blood pressure. They produce a critical hormone called erythropoietin. We'll come back to that, which tells your bone marrow to make red blood cells. They balance your electrolytes, things like sodium, potassium, calcium, and magnesium, which control everything from your heartbeat to your muscle contractions. They filter roughly 200 liters of blood every single day, pulling out waste products and toxins and sending them out of your body in your urine. When those filters start to break down, and they can do so over years, even decades, without your knowing, that entire cascade breaks down with them. The waste products that should be leaving your body start to build up in your blood. Your fluid balance goes haywire. Your hormones fall out of order. And then, like those dominoes, symptoms begin appearing in the most unexpected places. Your ankles, your eyelids, your fingernails, your skin. That is what we are about to explore together. So let's get into it. Sign number 1, puffiness around the eyes. The first sign, and one of the earliest ones that people often dismiss as poor sleep or allergies, is puffiness around the eyes. Not just the kind you get after a long night. I mean a persistent soft swelling that tends to be worse in the morning and may not fully go away as the day progresses. Here is what is actually happening inside your body when you see that puffiness. Your kidneys filter your blood through millions of tiny, incredibly delicate filtration units called nephrons. Think of nephrons like fine mesh screens. Healthy nephrons keep large, important proteins, particularly one called albumin, inside your bloodstream, where they belong. But when those nephrons become damaged, that mesh develops holes. Albumin starts leaking out of your blood and into your urine. Now, albumin is not just a protein. It plays a crucial role in keeping fluid inside your blood vessels. It acts like a sponge, drawing water toward it and holding it in your circulation. When albumin leaks away, that pulling power disappears. Fluid escapes from your blood vessels and seeps into the surrounding tissues. And where does it show up first? Right around your eyes. Because the skin there is thinner and more delicate than almost anywhere else on your body, it is the first place you will see that fluid accumulation. It is not a cosmetic issue. It is your kidneys sending you a distress signal. Sign number 2. Swollen ankles, feet, and legs, closely related to puffiness around the eyes, but caused by the same fundamental problem working with an additional factor, is swelling in the lower legs, ankles, and feet. This is called peripheral edema, and when it is caused by kidney disease, it has a very specific pattern you can look for. The kidneys that are failing are no longer able to properly regulate sodium, which is salt, in your bloodstream. When sodium builds up, it draws water along with it because water follows salt. Your body becomes waterlogged. And because of simple gravity, that excess fluid tends to pool in the lowest points of your body, your feet and ankles. Here is something you can actually check at home. This is called the pitting edemia test. Use 1 or 2 fingers to press firmly into the skin over your shin or your ankle for about 5 to 10 seconds. Then release. If the skin stays indented, if it looks like you have left a fingerprint dent in the tissue, and it takes a moment for that skin to spring back, that is called pitting edema, and it is a meaningful sign that your body is retaining fluid that it should not be holding on to. Now, I want to be honest with you. Swollen ankles have several causes. Heart disease, venous insufficiency, and certain medications can all cause edema. But when you are seeing it alongside any of the other signs on this list, it becomes a much more urgent signal that your kidneys need to be evaluated. Sign number 3. Changes in your urine. Your kidneys make your urine, so it should come as no surprise that changes in the look and behavior of your urine can be among the clearest windows into how those kidneys are functioning. There are 3 specific changes I want you to pay attention to. The first is foamy or frothy urine. I'm not talking about a few bubbles that disappear in seconds when urine hits the water. I'm talking about a persistent foam, like a bubble bath that lingers in the toilet bowl. This foaminess is caused by protein in the urine, a condition called proteinuria. Remember that albumin we talked about? When it leaks through damaged nephrons into your urine, it creates that characteristic froth. This can be one of the very first visible signs that something is wrong with your kidneys, sometimes appearing years before other symptoms develop. The second change to watch for is blood in the urine, which the medical community calls hematuria. This can range from urine that appears a pink, red, or brown color to blood that is microscopic, invisible to the naked eye but detectable on a urine test. When kidney filters are damaged, red blood cells that should never pass through the filtration barrier begin slipping through. Seeing blood in your urine is never something to explain away. It warrants a call to your doctor, full stop. The third urinary change is nocturia, the need to wake up multiple times during the night to urinate. Now, I know a lot of my senior viewers are nodding right now and thinking, Dr. Martin, I've been doing that for years. And yes, some degree of nighttime urination does increase with age. But here is the distinction. When your kidneys are healthy, they have the ability to concentrate urine at night, producing less of it so you can sleep through. When the kidneys begin to lose that concentrating ability, which is one of the earliest functions to decline, they produce diluted, high-volume urine around the clock, waking up 2, 3, 4 times a night to use the bathroom is not just an inconvenience. Sign number 4. Dry, intensely itchy skin. Here is one that surprises people. Your skin. When your kidneys begin to fail, they can no longer properly filter out waste products or maintain the right balance of minerals in your blood. 2 things happen as a result. First, uremic toxins, the waste products that should be leaving your body, begin accumulating in your skin. Second, phosphorus, a mineral that the kidneys normally filter out, builds up in the blood. Over time, tiny phosphorus crystals can actually deposit in the skin itself, triggering a relentless, maddening itch. This condition has a name, uremic pruritus, meaning itch caused by uremia, the toxic state that develops when the kidneys cannot clear waste from the blood. Uremic pruritus is not like normal dry skin. It does not respond well to moisturizers. It tends to affect large areas of the body, the back, the arms, the legs, and it can be particularly brutal at night, disturbing sleep on top of everything else. If you have been battling itchy skin for months, especially if it seems out of proportion to dryness, has no obvious allergic cause, and has not improved with typical remedies, please bring it up with your doctor. It may be telling you something your kidneys cannot. Sign number 5. Unusual paleness or fatigue. Your kidneys are responsible for producing a hormone that most people have never heard of but which is absolutely essential for life. Erythropoietin, or EPO for short. Erythropoietin is the signal your body sends to the bone marrow telling it to manufacture red blood cells. Red blood cells carry oxygen to every tissue and organ in your body. When the kidneys are damaged, they produce less and less erythropoietin. With less EPO circulating, the bone marrow produces fewer red blood cells. With fewer red blood cells, your blood carries less oxygen. The result is anemia. And this is not just a laboratory finding. You feel it. You see it. Your skin may take on a pallor, a washed-out, pale, almost grey quality, particularly visible in the face, the inner surface of the lower eyelids, and the gums. You feel profoundly tired in a way that sleep does not fully fix, because no matter how long you rest, your tissues are still not getting the oxygen they need. Anemia of kidney disease is incredibly common, affects the vast majority of people with advanced chronic kidney disease, and it is one of the most underappreciated reasons why seniors feel exhausted and look pale. If you have been told you are anemic and the iron supplements are not making a dent, it is absolutely worth asking whether your kidneys have been checked. Sign number 6. Changes in your fingernails. Now, this one is truly fascinating, and I encourage you to look at your own nails while I explain this. Your fingernails are actually remarkable diagnostic tools. Two very specific nail changes are strongly associated with kidney disease, and they are both visible to the naked eye. The first is called Lindsay's nails, also known as half and half nails. If you look at a normal fingernail, it has a whitish crescent-shaped area near the base, that is the lunula, and then a uniform pinkish-white color across the rest of the nail. In Lindsay's nails, the bottom half of the nail turns white, and the top half closest to the tip turns a distinctive reddish-brown or pink color. It creates a sharp, clear boundary right across the middle of the nail. This nail change was first described in patients with chronic kidney failure and is strongly associated with the accumulation of uremic waste products affecting the nail bed. The second nail change is called Muircher's lines, white horizontal bands, usually in pairs, that run across the nail parallel to the base. These are not ridges you can feel. They are flat discoloration bands in the nail bed itself. They are caused by low levels of albumin. Remember, that protein that leaks out through damaged kidney filters, which disrupts normal nail bed blood flow, creating those pale stripes. Muircher's lines can actually disappear when albumin levels are restored, which makes them a dynamic marker you and your doctor can use to track kidney function. Listen to your body. It is trying to tell you something, and sometimes it is speaking through your fingernails. Sign number 7. A strange taste in your mouth or odor on your breath. This one is deeply uncomfortable to talk about, but it is too important to leave out. When your kidneys are failing and waste products build up in your blood, a state called uremia, those toxins do not just stay in the bloodstream. They make their way into every body fluid, including saliva. The primary toxin involved here is urea. In the mouth, bacteria and enzymes break urea down into ammonia, producing what is known clinically as uremic phenol, a distinctive breath odor that is often described as smelling like urine, fish, or ammonia. Many patients describe it differently before the full breath odor develops, as a persistent metallic or bitter taste in the mouth. Food starts tasting wrong. Meat may become particularly unpleasant. You may find yourself losing your appetite entirely, not because you are depressed or bored with eating, but because your food literally tastes metallic or chemical. This happens because uremic toxins are affecting the very taste receptors on your tongue. This is not a hygiene issue. This is not solved with mouthwash. If you or someone you love has been experiencing a persistent metallic taste or a breath odor that seems to come from deep within rather than from the mouth itself, please do not ignore it. It is a sign that the kidneys may be severely overwhelmed. Sign number 8. Changes in skin color and tone. As kidney disease progresses, the skin can begin to take on a very particular appearance that goes beyond simple paleness. The skin may develop what is described as a sallow tone, a dull, yellowish-gray cast, as though the life has been drained from it. This discoloration comes from urochrome pigments, which are waste products normally filtered and excreted by the kidneys through the urine. When filtration fails, these pigments accumulate in the skin itself, lending it that yellowed, dusky appearance. It is worth noting that this is different from jaundice, which is a yellow discoloration caused by liver problems and tends to affect the eyes as well as the skin. The urochrome-driven discoloration of kidney disease is subtler, more of a grayish yellow than a vivid yellow, and the eyes are typically spared. In the most extreme end-stage cases, there is a phenomenon called uremic frost, which is exactly as dramatic as it sounds. When the kidneys are so compromised that urea concentrations in the blood become astronomically high, urea can actually crystallize on the surface of the skin, particularly on the face, neck, and arms, creating a whitish powdery deposit that looks, quite literally, like frost on skin. This is rare today because dialysis typically intervenes before things reach this point, but its very existence tells you something powerful about how completely the kidneys can manifest their distress through the largest organ in your body. Sign number 9. Muscle twitching, cramps, and restless legs. The final sign on our list today involves your muscles, and it comes down to chemistry. Among the many things your kidneys regulate with extraordinary precision are your electrolytes, specifically calcium and magnesium. These two minerals act like circuit breakers for your nerves and muscles. They modulate electrical signals and help ensure that muscles contract when they should and relax when they should. When kidney function declines, calcium and magnesium levels in the blood can drop significantly. Without adequate calcium and magnesium to regulate nerve signals, your muscles become what scientists call hyperexcitable. They fire when they shouldn't. The result is involuntary twitching, small, visible tremors under the skin, particularly in the arms and legs. You may experience painful muscle cramps, especially in the legs and feet at night. Many people with kidney disease also describe restless legs syndrome, an almost indescribable urge to move the legs, typically in the evening and overnight, which is often rooted in this same electrolyte disruption. If you are having muscle twitches or cramps that are waking you up at night, especially in the context of some of the other signs we have discussed today, this is not just your body being dramatic. This is your electrolyte balance calling for help. Who is most at risk? Now that you know the 9 signs, let us talk for just a moment about who is most likely to be on this road and may not know it yet, because awareness without context is not enough. The single biggest risk factor for chronic kidney disease is diabetes. When blood sugar is chronically elevated, it damages those delicate nephrons, those filtration units, over time. The damage is gradual and painless, but it is relentless. If you have diabetes, your kidneys need to be monitored regularly, even if you feel completely fine. Especially if you feel completely fine, because that silence is exactly what kidney disease counts on. The second leading risk factor is high blood pressure or hypertension. High blood pressure damages the tiny, fragile blood vessels that feed your kidneys, impairing filtration over years and decades. The troubling thing, both diabetes and high blood pressure are incredibly common among seniors, which is exactly why kidney disease is so prevalent in the over 65 population. Other risk factors include a family history of kidney disease, a prior kidney injury, and being over the age of 60, because kidneys, like all organs, naturally lose some reserve capacity as we age. What you need to ask your doctor today, here is your action plan, and I want you to write this down or screenshot this right now because it is that important. There are 2 specific tests that will tell you and your doctor exactly where your kidneys stand, and both are simple, non-invasive, and often covered by insurance for seniors. The first is a blood test for your GFR, your glomerular filtration rate. This tells you how efficiently your kidneys are filtering your blood. A GFR of 90 or above is considered normal. Below 60, sustained for 3 months or more, indicates chronic kidney disease. Below 15 is kidney failure. This single number is the most important indicator of your overall kidney health. The second test is a urine test called the UACR, your albumin to creatinine ratio. This measures how much albumin, that critical protein, is leaking into your urine. Remember all those damaged nephrons we talked about? This test quantifies exactly how leaky those filters have become. A result under 30 is normal. Between 30 and 300 signals early kidney damage. Above 300 indicates significant damage that needs to be addressed aggressively. At your very next doctor's appointment, I want you to look your physician in the eye and say, I would like my GFR checked and my UACR checked. If they ask why, you can tell them Dr. Phil Martin told you to ask. You have the right to know where your kidneys stand. Full stop. A word of genuine encouragement. Before I let you go, I need to say something important because I've watched patients receive information like this and panic. I have also watched patients receive this information, act on it, and turn their health around in ways they never thought possible. Kidney disease, caught early, is not a death sentence. It is a call to action. When detected in its early stages, lifestyle changes alone can dramatically slow or even halt its progression. Reducing sodium intake, managing blood pressure with precision, controlling blood sugar carefully, staying hydrated, limiting certain pain medications that stress the kidneys. These are not small or trivial interventions. For millions of people, they have been the difference between a manageable condition and kidney failure requiring dialysis. And beyond lifestyle, there are now excellent medications, including a class of drugs called SGLT2 inhibitors that have been shown in multiple large clinical trials to protect the kidneys directly, even slowing the progression of kidney disease in people who already have it. The bottom line is this: the window of opportunity is real and it is open. but only if you step through it. Your body has been showing you these signs: the puffy eyes in the morning, the itchy skin at night, the swollen ankles, the foamy toilet bowl, the metallic taste that won't go away, not to alarm you, but to inform you, to give you the chance to act while there is still time to act. Pay attention to your face. Pay attention to your skin. Pay attention to your nails and your urine and your muscles and your breath. All of these things are connected. All of them are your body speaking to you in the only language it has. Listen to your body. It is trying to tell you something. And today, I hope you are finally ready to hear it. If this video helped you understand your body a little better today, please share it with your spouse, your sibling, your best friend, your neighbor who has diabetes and hasn't seen a doctor in 2 years. You could genuinely save someone's life by pressing that share button. And if you want to keep learning how to protect your health as you age, not with fear, but with knowledge and confidence, make sure you subscribe and hit that notification bell so you never miss a video. I love you, my friends. Take care of yourselves. Take care of each other. I'm Dr. Clarence Martin. Stay healthy, stay informed.